So there are some telltale signs that give away a male face versus a feminine face, and that really has to do, one, with bony structure of the face, two, with the soft tissue and how full you are in different areas of the face, as well as the texture of the skin. And so as far as bony structure goes, male will have a much more prominent brow bone, and so it actually hoods over the eyes, really giving off a shadow. Most of the time the cheeks are a lot flatter, and the jaw is more wide, especially in the back here, and the back of the bone of the jaw actually flares out in the back in men. And then the chin is actually longer and wider. The last thing as far as structure goes is actually cartilage and not bone, but the Adam's apple is larger and longer. When you talk about soft tissue of the face, and this kind of goes along with hair as well, the hairline is a lot higher in men. Typically, in women, it's usually lower without the recession on the sides here. Going down, the cheeks are more full. There's a lot more sort of fatty tissue in the middle part of the face. The upper lip is shorter, so you're able to see the upper teeth when you open your mouth. And then the nose is actually smaller with less contour to it, so the tip doesn't project as far out from the face. There's no contour irregularities. It's flatter, and overall the shape is much smaller. As far as texture of the skin, nice feminine texture. Doesn't have stubble or irregularities from scarring. So even a woman that has some acne scarring, that can actually be more masculinizing to the face. And good collagen production, really shiny sheen, quality to the skin. So all of these qualities really highlight the eyes. So what I do in surgery to feminize the face is really making the eyes bigger. So even filling in the cheeks really bounces light into the eyes. Setting back the brow bone opens up the eyes, so it makes them literally bigger. We want to de-emphasize the lower part of the face and emphasize the upper part of the face. And lastly, that I haven't talked about yet, but actually looking younger is actually feminizing. So getting a facelift or blepharoplasty, a brow lift, those all feminize the face. If you've noticed, as we get older, if you see a man and a woman, both who've never had any surgery or skin treatments or anything, they kind of look almost similar. Anytime I do a procedure to make a person look younger, it also is feminizing. I don't require that any of my patients be on hormone therapy for any particular amount of time before surgery, and that's because even though hormones, meaning estrogen and spironolactone, they'll help with hair distribution. You might see some fullness and improved texture of the skin, but it's not going to change my surgical plan. The caveat to that is if you want to go through your insurance company, a lot of times they will require you to be on hormones for a year before surgery. That's not my requirement, that's usually the insurance requirement for approval. I do require my patients to be off hormones 2 weeks before their surgery, and that reduces the rate of blood clots in the legs. Facial feminization surgery takes hours and hours, and normally if you're laying in bed subconsciously without thinking, even while you're asleep, you do move around. When you are in surgery, you have muscle relaxers in your bloodstream, and basically you can't move for 5, 6, even more hours. And so with having higher doses of hormones, it does increase the likelihood of having blood clots in the legs. And we never want to risk that because we want all of our surgeries to be as safe as possible. Recovery can be very difficult, and I don't want to underemphasize that because it's a big change to the face. Usually you're wrapped in an ACE wrap for a week at least, and that gives some support to all the tissue underneath. You'll have an incision in your hairline or in your hair, depending on what we decide before surgery. That incision, if it's exposed in the front here, needs to be taken care of and kept moist. It's very difficult sometimes to get to a point to wash your hair, but that's very important because you may have some dry blood and debris in your hair, and that's a big step in getting it washed. You also have a cast on your nose if we decide to do rhinoplasty. And after rhinoplasty, you have some bruising and swelling around the eyes. Speaking of eyes, your eyes in the first 24 hours can actually swell shut. Sometimes I will give steroids and really ice the eyes, and that minimizes any swelling, at least to a point where you can see. If you have a lip lift, there'll be an incision underneath the nose here. And all of these stitches that will be here and hairline, they come out at a week. So all of these areas that have stitches have to be taken care of and kept clean and kept moist. And one of the hardest procedures to recover from is jaw contouring. The incision itself is inside the mouth, so you really don't have to do anything from that standpoint, but you get a lot of swelling. And so sometimes it's hard to eat, sometimes it's hard to talk, but it will gradually go down, and usually most people have the hardest time with that one because it still looks very swollen even a week afterwards. The Adam's apple reduction is very easy to recover from, actually, as far as procedures go. I have a small incision here and leave a purple glue that's water safe, so you can, get it wet and you don't have to keep ointment on it. Overall, most people take 3 to 4 weeks off of work, and that's just to allow all the bruising to go down, especially with the jaw, allow the swelling to go down enough to where they can be presentable in public. The incision won't quite yet have hair start growing through it, but at least it'll be to a point where you can wear makeup over it, and you can generally go about your day without wearing dressings or anything like that. So it's a difficult procedure to recover from, but well worth it because the results are dramatic. The final results, I usually tell my patients you don't really see for about a year, because it really takes a year for all the swelling to go down. And that's just because it's a lot of surgery, and it keeps changing over time, little by little.